Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to our event tonight where we're going to look at a topic for about 5, maybe 7 minutes or so, and then we're going to get into our question and answer time. So thanks for making this event a part of your evening. I hope and really trust that it's going to be a profitable time, that you'll learn some things that will benefit you, but also others, that you have discussions about Medicare. A couple things I want to mention real quickly. Number one, if you need some immediate assistance with anything that we're going to discuss tonight, sometimes people are down to the wire and have to make some decisions. Our office is still open. Our hours are Central Time. We're right outside of Kansas City, Missouri, in Overland Park, Kansas. So we're Central Time, 7 a.m. to 7 p.m. Monday through Thursday, and then tomorrow will be 7 a.m. to 6 p.m. And so if you need assistance, just reach out to us. We are brokers. We write in all 50 states and D.C., and so we can really help you with anything Medicare, Social Security related. We'd be delighted to be your broker. Number two, if you are new to our group this evening and have never joined our Facebook group, we'd love for you to be a part of that. I think we're well over 50,000 people now, where we share information. There are some experts in there that comment regularly, as well as people that have wonderful advice that have already been on Medicare or on Medicare, and they too will lend information that I think is very, very helpful. So we'd love to have you be a part of that. And then if you're not a subscriber to our YouTube channel or never been there, it is MedicareSchool.com. I think we have the #1 Medicare channel on YouTube right now, which we're grateful for. And so we'd love for you to go there. We have well over 400 videos of everything Medicare and Social Security related that would help you to have a great education. So avail yourself of those resources. There's no cost. And we greatly would appreciate if you would subscribe because that lets the YouTube group know that this content is valuable, and they'll send it out to other people. So that helps us. It helps you, because every time we do a new video, I've shot one new video today, and we try to do 1 or 2 a week. Every time we do a new video, then you're notified about that, so you can stay up to date on everything that's happening with Social Security and Medicare. So you can do that. And lastly, just a quick rule, you can start now putting in your questions, but do me a favor, make sure that you give us enough information where we can understand your question. I know people try to be concise and less wordy, but sometimes you're so concise that I can't understand what you're wanting to ask me. So be sure that I can understand your question. Our producer, Daniel, is with me, and so we'll do our best to try to get to as many questions as possible. I am 64. I will be 65 here in a few months, and I wear out about an hour and a half into this. But we'll last at least that long, and hopefully we'll get to your question. All right, so I'm going to get started with tonight's topic, and Daniel will give me kind of the official title to that. All right, so the question is, what kind of clients do Medicare agents hate to work with? In other words, we want to make sure that you're the kind of client that is someone that we, or really anyone, would want to work with. And so I'm going to give you several reasons why there are times when a client is difficult. And you don't want to certainly be that way, but these reasons that I'm going to give you, they're not in order of importance. They're all really important, and so I'm just going to kind of start off and go through my list. Number one, it can be troublesome and frankly annoying when people do not take the time to really understand a couple things. The first one would be making sure that you understand when is the best time for you to go on Medicare. So many times people are unaware that they don't have to start Medicare at 65. Now, some have to, but many do not have to. So we like to work with people who truly have an understanding that it is the right time to go on Medicare. When is the right time for you? And so you need to take some time to get educated about that. Again, we have videos on this. Our website has what we call the Essentials Workshop. But folks, just remember, not everyone has to start Medicare at 65, so please don't assume you have to. Now, there's some that must, and so just real quickly, who has to start Medicare at 65? Anyone that's no longer working, or their spouse is no longer working, and meaning you don't have an employer plan available to you, you have to start at 65. You just have to. If you are on COBRA insurance, same thing. You have to start Medicare at 65. You may keep your COBRA for a while. I wouldn't keep it too long. But if you keep it, you still have to start Medicare at 65 because COBRA is only the second payer at 65. If you're retired military, you have TRICARE. Again, you got to go on at 65, A and B, because TRICARE moves to the second payer position. Same thing happens if you're working or your spouse is working and you have an employer-provided plan that has 19 employees on the payroll or less. That's considered to be a small group. And just like TRICARE, just like COBRA, that small employer plan moves to the second payer position. So you've got to go on Medicare at 65 to put Medicare in the first payer position. And then this one is shocking to some people, and that is if you're on an ACA plan, Affordable Care Act plan right now, and you're approaching 65, you have to go on Medicare. You're going to drop your ACA plan. And some people say, well, Marvin, my ACA plan only costs me $50 a month, or it costs me $100 a month. It doesn't cost much. It's less than Medicare. I'm sorry, because here's what's going to happen. Once you turn 65, those financial incentives that you're receiving from the Affordable Care Act legislation are gone. You are not going to get any longer a reduced premium. You're no longer going to get any kind of cost sharing by the government. You're not going to get the tax subsidies. None of those financial benefits are available to you at 65. So if you stay on an ACA plan, what happens is you pay full premium, you pay full deductible, full max out of pocket. You're responsible for all of that. So folks, don't stay on an ACA plan once you're Medicare eligible. Come off that plan. You just simply have to. All right, so the whole point is know who has to go on Medicare and who doesn't have to go on Medicare at 65. All right, now there's one group that doesn't, and there's many of you that are watching this tonight, and that is if you or your spouse are still working and you're covered by an employer-provided plan that has 20 employees on the payroll or more, and that is an attractive plan, meaning your premium is $200 a month or less, your deductible is $1,500 a year or less. You like the plan, you like the network, you don't have to go on Medicare at all. You don't have to have A, you don't have to take B, you just stay on the group plan. Now, if you decide to take Medicare A and keep working, that's fine as long as you don't have a health savings account. Because if you take Medicare A, you can no longer contribute to a health savings account. So if I'm working and have an HSA, I wouldn't do A or B. You're not going to be penalized. You can pick up A and B at a later date when you retire. Now, if you don't have an HSA and you're not planning on having one or contributing to one, and you're going to keep working, or your spouse is, take A only. It's fine to do that. Just don't take B if you have an attractive plan. All right, so my point is this. That's the first kind of irritation, people not being aware of when they should go on Medicare, because we want people to go on Medicare at the right time. Second irritation is when people just don't understand the different options within Medicare. And again, this is an education issue. Take the time to get an education. You're watching this. Obviously, you're concerned about education. Watch the YouTube videos or others that actually teach on Medicare. Why? Because Medicare, all plans are not equal. They're different. And know the differences between supplemental plans and advantage plans. Understand those differences, folks, because it's critical to know how your insurance is going to work. Now, sometimes people don't care about that when they're 65 and healthy, but I can guarantee you this. When you're 75 or 85 and you're having health problems, you're going to care how your insurance is going to work. And there are differences. And so many people come into this decision blindly, not understanding the differences between supplemental plans and advantage plans. And there are some huge ones. I'm not going to teach on that tonight. I'll answer questions about it if you'd like. But again, that's a critical thing that can be very annoying that people just don't understand, because the decisions that you make about your insurance they're going to have consequences for you. And those consequences are what's going to happen if you get cancer, what happens if you have a heart problem or you need some kind of a serious surgery. Your insurance selection is going to matter, so know the differences. Another one would be people who just automatically do what their neighbor did, or they automatically do what their brother-in-law did. Now, that may work out for you, but it may be a rotten choice. I doubt you take the same medications as your neighbor, have the same health issues as your neighbor, have the same risk tolerance as your neighbor or your brother-in-law. So don't just simply copy somebody because that worked for them. It may be a great choice for you. It may be the worst choice for you. And so don't copy people. Know for sure what is going to be the best for your particular situation. Number 4, I get a little bit annoyed, frankly, from people that try to get advice from every Tom, Dick, and Harry, meaning they talk to everybody about their Medicare and they ask the questions. And the problem is they get all this varying advice because people have a varying degree of understanding of Medicare. And so what I find in this business, there are people sometimes who offer an opinion and they mean well, but they don't really understand Medicare well enough to give anybody advice. And I say it this way, they may understand how to begin to put the pieces of the puzzle together, but they can't put the whole puzzle, Medicare puzzle together. They just don't understand how to do that. So they give you advice, and some may be accurate and some may be not. And if you listen to someone who really doesn't fully understand Medicare, you act upon their advice, you can make a serious mistake that could cost you literally hundreds of thousands of dollars and a decision that you may never be able to reverse. So that's annoying. Well, this person said this and this person said that. Well, tell me about it. How long they've been in the business. How many thousands of clients have they helped before? In other words, those things matter. And who I find who tend to pretend to be the experts are those that just went on Medicare. They made a good decision for themselves, but that doesn't mean they're going to be able to help you. So don't listen to every Tom, Dick, and Harry. Find people that truly understand Medicare that can give you advice that is going to be reliable, that you can go to the bank on. All right, so that is very important. Also, those that wait to the last minute to make a decision, maybe because of confusion or procrastination. Now, folks, I wouldn't do that. People ask me all the time, Marvin, when do I call you? Folks, the ideal time is anywhere about 60 to 90 days before you retire, or 60 to 90 days before you are going to be eligible for Medicare. Now, by the way, you can do that, this decision, sometimes as early as 6 months. In some states, they actually let us secure plans 6 months before your Medicare effective dates. Some states are 3 months. All right, but definitely you don't want to do it last minute. Take the time to understand. That way you're not making impulsive decisions. You know the saying, haste makes waste. And you don't want to be hasty. You want to make a good, thorough investigation, making decisions at the right time, and again, not being last minute. And also, people that look at premium only. In other words, that's the biggest thing to them in this decision is what is it going to cost me on a monthly basis? Now listen, monthly premiums matter. Okay, we all have to live within our means, and we all have a budget, right? So I'm not saying monthly premiums are insignificant, but I will say this, monthly premiums are not the only part of the story. My opinion is if someone can afford a little extra on a monthly basis to get a supplemental plan, I think long term they're going to be very satisfied and very pleased with that supplemental plan. Sure, it's going to cost them more on a monthly basis, but if they get sick, I can assure you, you will spend less money on your Medicare supplemental premium than you would max out of pocket on your Advantage plan. Sure, the Advantage plan may have a zero premium, but it's not going to be zero to go to the hospital, zero to get an MRI or a CAT scan or see a specialist or have an outpatient surgery. It's not going to be zero. You're going to pay as you go on the Advantage plan, and that pay as you go risk on the Advantage plan right now is anywhere from $3,000 to $5,000 a year on an HMO, somewhere between $5,000 to $10,000 on a PPO plan. If I have a $150 Medicare supplemental plan monthly, that's $1,800 a year. I have a small deductible, $257, so I spend about $2,000 for my cancer versus $12,000 if I was on an Advantage plan or $5,000 on my Advantage plan. Because when we have serious health issues, we almost always spend less money in premium on our supplemental plan than we would on our Advantage plan. So I'm saying to you, premium is not the whole story here. You got to pay attention to the actually out-of-pocket costs for copays and co-insurance and your actual risk if you had a serious health issue. Now, that being said, sometimes people say, Marvin, I simply cannot afford the monthly premium on a supplemental plan. Then don't try to get one. I think that's very unwise because what happens if you try to afford it and you can't, you won't keep it. And so what I would do when I first go on Medicare, if you can't afford a supplemental plan, get a great Advantage plan because they're still fine insurance. Now, they've got some disadvantages that you need to be aware of. Again, that's part of the education process. Most agents don't tell you about the disadvantage of Advantage plan. Why? Because they want you to get an Advantage plan. Why? Because they pay us great money. We make twice the commission on Advantage plans as we do a supplemental plan. We just do. They pay twice the initial commission with lifetime residuals. Supplemental plans pay half the commission, and we get paid residual for 6 years, not lifetime. And so it's to the advantage of the agent for you to get an Advantage plan. It's true. Insurance companies make billions off of Medicare, and insurance agents make lots of money too. But is it in your best interest? Sometimes it is. And if that's the case, let's find the very best Advantage plan we can for you. But my whole point is it's not just premium. Look at all the financial aspects around that plan. All right, I'm almost done. And then another one that can be annoying are people that are very healthy, which is a blessing, and they take no medications. I'm in that. Okay, I take no medications whatsoever, prescriptions. Take supplements, but no prescriptions. And so sometimes people in this situation, because they take no prescriptions, do not want to get a drug plan. There may be a premium with the drug plan, and they don't want to pay for that. Folks, that is not wise, and I'm going to tell you why it's not wise. You can get a drug plan today. Some of them are zero premium. There's several that are less than $25 a month. And so for $25 a month, you can basically reduce and eliminate almost the risk if your health were to change. You may be healthy today, and in 6 months, you may have cancer and need $7,000 a month chemotherapy pills. You may get diagnosed with Crohn's or psoriatic arthritis or some serious autoimmune disorder, and you need Stelara. That's $13,500 a month. In other words, there are very expensive medications. Some of the cancer meds out right now, new ones, listen folks, they're $285,000 a year. A year, okay? So what happens? If I have a drug plan, whether that's a $20 drug plan, a $10 drug plan, an $80 drug plan, the most you'll spend on medications this year out of your pocket is $2,000. So for a little small premium, or is even zero sometimes, you can eliminate the risk of having to be on expensive medications because the Medicare cap this year is $2,000 for you. And so when people say, well, I'm not getting a drug plan, I don't need that, I don't take any meds. Well, that's fine and dandy today, but what happens if your health changes in 3 months or 6 months, you don't have a drug plan? You just can't add a drug plan when you want to. You can add a drug plan once a year, October 15th to December 7th. That's it. And that plan doesn't start until January 1. So you could go months and months and months without a drug plan because you didn't want to spend $20 out of your pocket to get a monthly drug plan. Okay, so that's annoying because I know people's health can change quickly, and when that happens, it could cost you drastically. And then the last one, this is kind of a funny one, but it's true. I meet people all the time that think that and expect that Medicare is going to be free. Okay, Medicare is not free. Now, it is true as long as we have 10 years worth of taxes paid into the Medicare system. We call those quarters, 40 quarters, 10 years of taxes paid into Medicare. We get Medicare Part A premium free. There's a zero premium on Part A. But everything else within Medicare is going to cost except for preventive services. And I'll have people say, well, I worked all my life. Why wouldn't this be free? Well, that's just not the way the system works. Okay, Medicare is an excellent value. It is, but it's not free. You're going to have to pay for Medicare Part B. There's a premium this year, $187 a month. You're going to have to buy a supplemental plan if that's the way you choose to go. Or if you don't choose a sup and you go with Advantage, you're still going to pay as you go. So it's not going to be free. Enroll in Medicare. It's a wonderful value. It's wonderful insurance. And so when people say, it ought to be free, I'm sorry, it's not. All right, so those are some of the things. So all I'm saying to you is these things can be annoying, cause us to say, oh, this person is difficult around these areas. So just know, get an education. Know when to go on Medicare. Know the differences between SUPs and Advantage plans. Know the importance of having a drug plan, whether you are taking meds or not. And then understand, don't copy people. Make a decision that's going to be in your best interest because you were willing to do your due diligence, do your homework, and come to a place where you're confident that you understand the Medicare system and what is going to be your best selection. All right, so those are the issues. I am now going to take questions. Remember, I'm a financial advisor, so I know quite a bit about Social Security, of course, Medicare as well. I'm not going to get into a lot of tax issues. I'm licensed in securities and all, but any question that would be Social Security or Medicare related, I'm happy to take those. I'm not saying I know it all, but I'll do my best to answer your questions. So you can start putting those in the chat, and we'll get started, Daniel. I'm ready. All right. Gary, I'll be 66 and 8 months in 3 months. I work for an employer who has had 20 employees on the payroll until last week. Someone quit. How long do they have to hire someone to reach 20 or more? Well, first off, can we go back to that question?
What was the rest of
Oh, and if they don't, how long do I have to file for Part B without being penalized for life? Okay, well, first off, Gary, I've never had that situation before. So when you say you're 66 and 8 months in 3 months, I'm trying to figure out 66 and 8 months. That probably tells me that you were born in 1958. Are you telling me that's why? Because anyone born in 1958 has the full retirement age of 66 and 8 months. So if you're born in so I'm not sure the significance of that to your question, Daniel. Am I missing something?
I think it's just mentioning age.
Okay, mentioning. Okay, very good. Okay, got it. So I don't think that matters there. So you work for an employer as 20, and now we have 19 or less. So here's your dilemma. If you had a claim that was filed, and so right now it sounds like you have nothing. So how long do they have to hire someone to reach 20 or more? What's the last part of the question, Daniel?
Yeah. If they don't hire anybody else, how long?
Okay. Okay. Very good. Okay. So it's not that you're in jeopardy right now of getting penalized on Part B. Your problem is going to be once that group, and I would assume you probably have, you definitely have some time. But your problem is if it's a small group plan, that small group plan moves to the second payer position. 20 or more group plan pays first, and then Medicare would pay second. 19 or less, that's going to be reversed. And so as far as a claim is concerned, you're going to have to ask your insurance company how they treat that. I'd want to know that. I would call them and say, okay, by Medicare standards, we're now considered to be a small group. How long do we have before we'd be considered to, if there was a claim where I need to be enrolled in Medicare? They ought to be able to answer that question. If not, I can tell you this. From the time that, let's say that employer plan were to end, you actually have 8 months to come into Medicare Part B with no penalties or problems. So as far as enrolling into B, as long as you have had credible coverage from 65 until now, which you have, and we verified that with the proper forms called an L564, then you still can come into Medicare B and start that within 8 months of when that employer plan changed from large to small. Okay, that's official with Medicare. Okay, but when it comes to the claim, then my concern for you is if you had a large claim, is that insurance company that's covering your work now, are they going to consider themselves now to be in the second payer position? You have to find that out. Now, I'd venture to say you're probably going to get, it may be difficult to get to somebody that knows the answer to that. That's a little bit in the weeds for sure, but I would still call and ask them that. So you'd say, if I had a claim, let's say I had a cancer claim of $30,000, we are now a small group, who is going to pay first and who's going to pay second? Because I know if it's 19 or less, that small group plan definitely moves to the second payer position. You have to enroll in Medicare A and B to put them in the first payer position. So Medicare allows you to come in during that period of time within 8 months of losing that coverage. 8 months. But for claim purposes, you may not have that 8 months. So you're in a predicament that I've never seen before. I've never had it happen. So hopefully they'll soon be able to add somebody to get back to that 20. And keep this in mind, it is employees on the payroll. That can be part-time or full-time. It's not how many people are on the plan, but are on the payroll. All right, so hopefully that helps. I know I rambled on. Let's keep going, Daniel. All right, I just enrolled in Plan N. What are my options for dental, vision, hearing? Okay, I don't know if you're a client of ours or not, but usually our agents talk with our clients about dental, and I think dental plans are wonderful. I would tell you this, the dental plans and the vision plans, the dental vision plans, there's several of them that are available. I do suggest you really call in and let us go through that. But what you're asking for is this: you want to make sure that you ask your dentist what the dentist likes and takes. In other words, what insurance plans do they take, and do they have one that they really prefer, and why would they prefer that? So that's number one, because if you have a dentist that you like and you don't want to switch dentists, then it'd be great if you could get a plan where they are considered to be in network. Now, if they're not in network with any plan, it's no big deal because most dental plans are going to be PPO. You can go anywhere you want. Now, if they're in network, then the claim process is a little easier, but if they're not, you can still, either they'll file the claim or you file the claim, you pay cash and they file the claim, or you do, and then you can get reimbursed by the plan. All right, so that's number one. Number two, what I'd be paying attention to is what do the benefits look like on that dental plan? What's the annual benefit? Some plans are as low as $1,500 a year. Some are as high as $5,000 a year. So that matters. So find out about that. What's your monthly premium? Do you have a deductible? Some of them have a $50 deductible for the whole year, and that's it. What's the coverage for periodontal work? What's the coverage on a root canal or a crown or an extraction or a filling? Most plans cover basic services at 80-20, major services at 50-50, up to the max. So those are the kind of things that you need to be asking, and we'd, of course, be happy to help you. Now, when it comes to vision, the two primary networks are iMed and VSP. An iMed plan's about probably $12 to $15 a month. A VSP plan is going to be anywhere from maybe $15 to $18 a month, depending upon the carrier. But what they're going to do is give you an eye exam once a year at no cost, and then give you some discounts and some credit towards eyewear. Now, when it comes to hearing, there are not a lot of standalone hearing plans. They're usually about $300 a year benefit total. Many times today, people get over-the-counter hearing aids at a very reasonable cost. If there's a prescription required, then again, you could use that credit from that dental vision plan, because again, they'll usually have a little bit of a hearing benefit. So that's what I would do. Call us, call somebody, and let them look at the different options that are available in your area, compare the premiums, the coverage types, and the max benefit for the year. All right, and don't forget networks. Okay, let's keep going. Okay, I spoke with your representative, David, this week. He told me that I didn't have to do anything until I retire. However, apparently I do. I have to sign up for Medicare Part A or I'll be penalized. And Sandy, people are told what you have been told by others all the time, that they have to take A or they'll be penalized. And it's absolutely not true. Sandy, if you have paid into the Medicare system for at least 40 quarters, that is 10 years worth of work. If you paid into that, there is never a penalty on Part A, no matter when you take it, okay? The only people that pay a penalty on A, and so David was telling you is correct, the only people that pay a penalty on A are those people that have to buy Part A. And when they buy Part A, they're paying a premium for it because they don't have 40 quarters or they couldn't get it from a spouse. So people less than 40 quarters, they better take it at 65 or retirement, or they will be penalized. But as long as Part A is premium free and you have 40 quarters or more, you'll never be penalized, I promise you. Now listen, the only reason this matters is if you have an HSA. So if you're contributing to an HSA, don't enroll in Part A. You won't be penalized at all, and you can keep contributing to your health savings account. Now, if you don't have an HSA, go ahead and enroll in A. It's going to be zero premium to you. It pays second. It's not going to pay first. It'll pay second. And so I encourage people to take A only as long as they're not contributing to an HSA. So it's fine. So maybe you have one, maybe you don't, but you're not going to be penalized as long as you have 40 quarters. David was exactly right. Hey, folks, listen. I've had people from the Social Security office say that you'll be penalized if not, and they're just simply wrong. And how do I know that? How can I be so dogmatic? Here's why, folks. Because Part A penalties are a percentage, and here's the way it works. If you have to buy, buy Medicare Part A and pay a penalty because you're late, for every year you didn't have A when you should have, it's a 10% penalty, and you pay that double the years. So if I go without Part A for 1 year, it's a 10% penalty that I pay for 2 years. If I go without Part A for 2 years, I pay a 20% penalty, and I pay it for 4 years. So it's a percentage, and we pay double the years. All right, so let's say that you don't take Medicare Part A until you retire at 75. That's 10 years later, okay? That's 10% a year. That would be a 100% penalty on Part A. What is 100% of zero? Zero, okay? What's 1,000% of zero? Zero. So if Medicare A is zero because you have 40 quarters, you'll never be penalized on Part A. The only people who are penalized are 1% of the Medicare population. They don't have 40 quarters. So if they're buying Medicare Part A right now, if they have 30 to 39 quarters, that's $285 a month. What's 10% of that? $28.50, okay? So the people who have penalties are those that have to buy Part A. That's it. So David was right. I'm sorry you got bad information from someone else. But again, if you don't have an HSA, take A only. It's no problem. Let's keep going. All right, Gwen, I have COBRA and want to keep it as primary coverage until the last month of my IEP. Can the COBRA folks force me to enroll in Medicare during my birth month, or can I wait until month 6 or 7 of my IEP? Listen, Gwen, your idea, I'm sorry, and I'm not trying to be rude or offensive, but you can't do what you're wanting to do, okay, at all. Okay, here's the problem. You don't get to decide, Gwen, who is primary and who's secondary. Medicare decides that. So here's the way it works. If someone is still working, now I want everyone to track with me. Here's how it works. If someone is still working and there's 19 people or less on the payroll, Medicare is the primary payer, the group plan is second. If you're still working and there's 20 people or more on the payroll, then your group plan pays first and Medicare pays second. Okay, now, if someone is on COBRA, here's the way it works. The COBRA payer moves to the second payer position as soon as you are 65. All right, so you can do what you want to do. Go and put your B off until the last month of your IEP, but you're the first payer from birth month on. So that's a bad idea, Gwen. Don't do that. What I would do if I were you, I would go ahead and enroll in A and B effective your birth month. You don't have to get a supplemental plan yet. Go ahead and use that COBRA for a few months, no more than 6 months, and let it be the second payer. It also have a drug coverage, so it's credible, so you're fine there. But take A and B at 65, keep your COBRA. Again, I'm not going to keep it for my coverage more than 6 months, because if you go beyond 6 months of your B date, you are going to have to medically qualify to get a supplemental plan. All right, and so again, make sure it's not that COBRA is making you go on Medicare. What they're saying is that we're going to pay second, so you better go on Medicare, because if you don't put Medicare in the first payer position, you become the first payer. All right, so don't do that, please. Let's keep going. Hope that helps. All right, Duncan, we turned 65 in roughly 6 months, want Medigap Plan G in Texas, but we might in a future year move to Virginia, North Carolina, South Carolina, Alabama. What are the top 2 companies for us to focus on? Okay, Duncan, number one, now, and by the way, just so you know, our home office is in Overland Park, Kansas, which is a suburb of Kansas City. All right, we're a nationwide broker. I think Texas is one of our top 3 states in the country where we're at business. So I'm well versed with Texas. Lots and lots of different supplemental plan options there. Okay, so I can't, for the sake of this educational event, I cannot tell you companies, and so I'm not going to. Okay, but listen, Duncan, call in, and one of our agents would give you a variety of companies that are available in your particular county, your zip code, and they will tell you who's available and who it is that offers the most stable rates, so you can decide. Because remember, when it comes to G plans or N plans, whatever you buy, the coverage for medical, inpatient, outpatient, is identical. There's no difference in coverage. So one company is never going to pay different bills, different amounts of bills, different types of bills than another. These plans are all standardized by Medicare. So you can't pick a company based upon who's going to cover you better. That doesn't happen. What you're looking at is 2 things: the initial premium being charged and the premium stability of that company in the last 10 years. That's what you're looking at. And our agent can go through that with you so you can select a company. So there is no good, better, best. It's a matter of rate stability with the carrier. Now, what's going to happen when you get a supplemental plan in Texas, you're going to take that with you to wherever you move. And all those states there are going to be very similar in their rates. There could be a little difference, $5 or $10 a month, but it's going to be probably pretty minimal whenever you move, because with the supplemental plan, it's permanent plan. It can never be canceled because you relocated. So when you move, that carrier company has the right to re-rate you. It can go up, it can go down. And again, it's usually pretty insignificant. Now, if a person lives in Texas and they're going to move to New York, that's going to be a substantial increase. Okay, in fact, anywhere you move in the Northeast, probably going to go up substantially. Virginia, not so bad. Definitely North Carolina, South Carolina, Alabama, you should be fine. Those rates are going to be very comparable to the rates in Texas. Okay, and so call in, and our agents will tell you about the different companies, and they'll be happy to assist and answer that question specifically. All right, Daniel, let's keep going. Doug, when excess charges would be imposed, would the 15% be imposed on the Medicare approved amount and not the provider's original charge? No, it's definitely on the Medicare approved amount. It's called a fee for service. So when Medicare has determined that they're going to pay X amount for a surgery or for a specialist visit, if that doctor charges excess, it's going to be a 15% above that amount. So if that service is, let's say $100, the most they can add then would be $15 to that. 80% be paid by Medicare of the original fee for service. You're responsible for 20% and the full 15% excess charge as well. So that's the way that works. Okay, let's keep going. All right, is underwriting required to change from G to N? Well, just depends on where you are. There are some states in the country, there's I think about 14 of them right now, that are called birthday rule states. Virginia just became a birthday rule state recently. It was passed. But a birthday rule state, you can usually move from like product to like, or like to less. So that would be G to G or G to N, like to like to less. And you can do so without underwriting around your birth date. Sometimes it's 60 days around your birthday, sometimes it's 90. There's different rules by states. But California, Oregon, Washington, now Washington, by the way, is annually you can do it. Then Idaho, Nevada, Louisiana, Oklahoma, Missouri, it's called anniversary rule, state of Illinois, Maryland, Kentucky, now Virginia. So there's a few states where you can move from G to N with no underwriting. Now, there are some states that's just like to like, where you have to go G to G or N to N. So you just have to find out what the rules are in your particular state before you'll know exactly, the precise answer to that question. But if you're not in a birthday rule state, then yes, you would have to go through underwriting to move from a G to N, which is going to be most of the states presently. All right, Daniel. Reggie, did I understand correctly that the 50% the doctors can add to the bill do not apply to New York residents? Okay, my understanding is this, Reggie, that in New York, excess charges are allowed, but no more than 5% can be added. There are actually 7 states where excess is not allowed at all, and those would be Pennsylvania, Ohio, Rhode Island, New York, and then, again, that'd be 5%. Connecticut, Vermont, Maine, and Massachusetts. I'm pretty sure I'm right on those states. Sorry about that. But the point is, there are some states where it's not allowable to them to add excess charges. In New York does not allow the full 15, but they do allow 5%. All right. So that's the way it works. All the other states, they can add the full 15% if they so choose. There's 2 types of doctors, well, actually 3 types of doctors within the Medicare system. Those are those that are what we call participating providers. They accept Medicare approved amounts, reimbursement rates as payment in full. That's participating providers. Then there's non-participating providers. They accept Medicare, but they're going to add 15% of the bill. They can do that. And then there's those that have opted out, which are very rare. Less than 1% of doctors are opted out, but they don't take Medicare at all. Okay, and so your non-participating providers are in the Medicare system, but they're not under the contract where they must accept those Medicare approved amounts. They add 15. Okay, let's keep going. Okay, kudos to your staff, Aaron and Haley. They've been super helpful. Well, thanks for the encouragement. We have a couple Aarons. We only have one Haley, but both Aarons I know are top notch. So I'm glad that you were helped, Edgar. It's our privilege to be your broker. Let's keep going. All right, I have a Medicare supplemental plan, which I got from you folks. I'm very happy with. I need rotator cuff surgery. Any pre-approvals needed? Mark, there should not be. What I would do, of course, you can go to whatever orthopedic doctor you're going to use to do the surgery, and you just have to ask them if they take Medicare. As long as they take Medicare, then they will tell you if there's any kind of process involved at all. I'm not aware of any with rotator cuff. If it's certainly medically necessary to do the operation, and would be, or you wouldn't be going through it, that's for sure, then they will let you know if there's something that would be required. But the supplemental plan, there's no pre-approvals whatsoever, ever. If Medicare says it's covered and your doctor says you need it, then end of story, you don't have to worry about it at all. But great question, Mark. Let's keep going. All right, my doctor told me if I signed up for a supplemental plan, he could not accept my medical insurance. Why is that? Well, Philip, that can happen if that doctor that you go to is owned by the Advantage company. And there are organizations out there today that only take Advantage. They're few and far between, but they still exist because they're owned by that Advantage company, okay? So that doctor is not paid by Medicare, they're paid by that insurance company. So whoever pays them owns them. So that's what's happened. And I'll hear what you're saying to me. That may happen, I'll hear that maybe once a quarter. And so the other issue I find, if that's not the case, where they're not owned by the Advantage company, then you're dealing with a doctor's office that doesn't understand the difference between supplemental and Advantage. We hear this all the time, frankly. People will say, well, I'm on this X plan, and the doctors say they don't take it. Well, if it's a supplemental plan, they have to take your supplemental plan, unless, of course, they're owned by the Advantage company. They don't have to. So that could also be the case. You're talking to an inexperienced person in billing or an inexperienced novice working the front desk, and you told them who you have with your supplemental plan. They looked it up on the Advantage list and realized we don't take that plan. Well, if they take original Medicare, again, they have to take your supplemental plan of choice unless they're Advantage only. That's it. I'm going to keep going. Hopefully that helps. Alrighty, do I have to wait till it's exactly 3 months before I can apply for Medicare, or can I do it a little early? Well, Philip, about maybe 2 weeks early. Okay, so friends, let's just look at it this way. Let's say that my birthday is in April. we'd back up the clock and say March, February, January. So probably mid-December, someone could have begun to apply. Officially, it's 3 months, but that online system normally opens up about 2 weeks before that 3-month window. Now, if you're applying for Social Security at the same time as Medicare, you can do that early. That's actually 4 months prior to when you want to start your Social Security benefits if you start those at 65. But again, technically your initial enrollment period is 3 months before you turn 65, the month you turn 65, and 3 months after. But again, it opens up about 2 weeks prior, about 100 days prior to your effective month. All right? Okay, here we go. Paying for my own meds right now, cheaper than $2,000 deductible. Should you initially go with a cheaper drug plan and then change later if more expensive drugs are needed? Okay, Jennifer, a little bit of confusion here because there is no Medicare Part D plan that has a $2,000 deductible. That $2,000 is max out of pocket. The deductible for Medicare Part D plans this year is $590. All right, so yes, it is true you'd be responsible for the first $590 out of pocket. But after that, what happens is you pay about 25% coinsurance until you have reached the $2,000 max out of pocket. All right, and so you said, should you initially go with a cheaper drug plan and then change later? So that is fine. But here's the thing. I don't look at it at the premium. I look at my medications. I want to make sure that I'm on a drug plan this year that covers my meds. Okay, so if that premium is $90 or $5, that doesn't matter to me. What matters to me is, are my medications covered and in formulary? Because that $2,000 max for the year includes medications that are in formulary. So that's what's first. That's what matters. It's not premium. Is it covered by the plan? Then that $2,000 would apply. Because as long as I'm running those medications through my plan that are in formulary, I'll never spend more than $2,000 for the whole year. Okay, so it's not a deductible. It's a max out of pocket. Okay, I hope that helps. And by the way, you can switch drug plans annually. So if I need more meds next year, less meds, I change October 15th through December 7th. New drug plan kicks in January 1. All right. If you can't afford Medigap plans, 64.5 isn't there copay protection plans without medical underwriting similar to Medigap, a cheaper route? Okay, it definitely is. So I think it's wise when people cannot get a Medigap plan and they're have to get a Medicare Advantage plan. I like copay protection plans. And for those of you that are unfamiliar with these, I want to clarify something. Copay protection plans are also called hospital indemnity plans, critical illness plans, and I like them, especially if you have an Advantage plan because of this reason. Number one, they're very low cost. Most of them are anywhere from $25 to $35, $40 a month. And what they're going to do is help offset some of the expenses that you're responsible for on your Advantage plan, which would be your hospital copays, sometimes ambulance, different things like that. They will actually pay you and reimburse you if you have those services. So you can afford to be able to pay those bills. Plus, if you're starting at Medicare eligibility at 65, and this is what you're talking about, no underwriting, then you can get those plans regardless of health conditions. Now, if you want to get a cancer rider, they're going to ask you a couple of health questions. And so it is cancer and hospitalizations that really hurt people that are on Advantage plans. If they can't afford the copays, then they should get a copay protection plan to cover those expenses. Again, it's $30, $35 a month, a very, very good value. So, Paul, that's a great idea. Okay, let's keep going, Daniel. All right, attained age versus issue age policies, what's the best? Well, the difference between the two, there really is no best. There's not. Now, I know agents who will tell you that issue age is better versus attained age, and they'll say because issue age is not going to raise their rates because of your age. Okay, so they push that typically because they work for a company or they're pushing a product from a company that is issue age. Okay, so some of you are saying, what on earth is he talking about? Let me just give you as quick and brief as education as I can. So what happens when an insurance company decides to do business in any state, that state insurance company normally has some rules about how policies are going to be rated, how they arrive at those initial premiums, as well as future price increases in the future years. And so the insurance company dictates what is going to happen. Okay, and so there's only 3 different rating options. Those are attained age, issue age, and community age. So attained age is the type of policy that is you pay your premium based upon the age you are when you take it. So a 65-year-old pays less than a 67-year-old. Okay, and then what happens is every year at the anniversary of the policy, on an attained age policy, that premium, monthly premium, is going to increase every year. As you attain another age, the premium goes up a little bit. That small amount of increase is normally around $40 or $50 a year. That's it. So you take $40 or $50 a year, you divide that by 12, you're going to look at a $4 a month increase. That's going to happen automatically every year as you attain an age. So it's going to go up. Starts the lowest, and then every year goes up a little bit. Now, issue age policies start kind of in the middle, and they too, like attained age, are going to establish the premium based upon the age that you are when that policy is issued. Again, a 65-year-old pays less than a 67-year-old. But the difference between attained age and issue age is this. The issue age policy can only go up when there's a group increase. Issue age, you pay more for if you're older when you first get it, but it doesn't go up every year because of your age. But it still can go up with a group increase. Okay? So the last option is community rated, and these are the highest. And there's very few of these states. I think there's a handful of them, most of them in the Northeast. And these are states where everybody that is getting a supplemental plan at the same time, whether you're 65 or 85, you pay the same price. So when the insurance company prices those policies, they kind of have to average it out. So frankly, the 65-year-old pays too much, and the 85-year-old pays too less of amount. And so, but they have to average it out. And so again, those are the highest. But here's what I'm trying to teach you: whether you have an attained age, an issue age, or a community age, all of them can go up because of group increases. Okay, issue age goes up because of group. Community goes up because of group. Attained age goes up because of group. Okay, so how does that happen? Well, it happens when the policyholders in the group pay in their premium, company pays out claims. And whenever claims exceed premiums, you are going to get a group increase. I don't care whether it's attained age, issue age, community. When that company starts losing money, they are going to raise those rates. Okay, so I'm not going to tell you what's best, because what really matters is how large is the group. I would much rather have an attained age policy that's going to go up every year but has a large group than an issue age policy that can only go up because of group. Okay, why? Because they're both going to go up because of group anyways. So once that company loses money, folks, those rates are going up. So what you ought to look for is a large group. I use a silly illustration, but it's true, and that is this. When I look at a supplemental company, I am looking at market share. How many people, thousands of people, are going to be in my group? Why? The more the better. Why? The more policy holders, the more the risk is spread out to those policy holders. So the bigger the better, the larger the group, the greater market share that company has is really what's most important, not whether it's issue, attained, or community. That really does not make the biggest difference. It's size of group. And so my silly illustration is this. If you're in an ocean and you're in a canoe and you're in the middle of that ocean, there's a storm, but you're really going to feel every single wave that hits that canoe, probably going to go over. Why? Because small vessel, huge body of water. But if you're in that same body of water, that ocean, and you're in a cruise ship, you hardly even know. Sometimes you're even in a boat, in a ship, because those waves don't have as much impact upon that vessel. And that's the way it is with med sups. If you have a small group, a company has a small market share, a more regional company, and you have health problems in that group, you're going to feel the waves of that through price increases. But if you're in a large group, a national company that has a large market share, not going to feel the impact that as much. They're all going to go up for sure, but not as drastically and as much and as often when you have a large group plan. So that's why we make a big deal of rate stability as we help our clients. Okay, so Charles, it's not about attained or issue age. I promise you it's not. It's about the group size. Okay, let's keep going. All right, we already have Part G supplemented where your company write only a Part D plan went up for renewal. Yeah, we will not, Mike. And frankly, I will tell you this, we will be happy to send out resources for you to do that. But the reason is there's no money in Part D plans. We write those for our clients because we know how important a Part D plan is. But if you're not our client through supplemental, we're not going to write a Part D plan. No one works for free. You didn't work for free. We can't work for free. But there are some great resources we put out. You can go to Medicare.gov and look at those as well. They're really very, very easy to do. But those who we write supplemental plans for, we will help them with their initial Part D selection, and then we have other tools that they use when Part D plans come up for renewal every year. Okay, so not by itself, just can't do it, cannot. All right, let's keep going. Okay, if I sign up for Medicare Day when I'm 64, retired, and then go abroad for a year, do I lose Medicare? And forever pay penalties, or is there a new SEP that allows me to re-register? Okay, TJ, I'm not an expert in this question here, okay? So if what you're saying to me, you sign up for Medicare and then you disenroll from Medicare Part B, will you be able to get back in without penalty? Here's the way I think it works. Wherever you're moving to, if they have some type of a national insurance plan, in other words, that you can get through that country, then I think you would qualify for an SEP when you come back into the States. Okay, now if I were you, what I would do is I would call your local Social Security office and tell them what you're thinking about, wherever you're moving to, and let's find out if they do have a national insurance plan, and then what you would have to do to qualify for an SEP is have proof of that credible coverage. Okay, that's what I would do. So I'm not going to be dogmatic because I don't know where you're moving to, and I would definitely run that by a local Social Security office to make sure. And maybe you can call Medicare, but we find that we're calling Medicare number is typically for claims and those kind of problems. We find that the Social Security offices, when you get somebody smart on the phone, well, not smart, but someone well-trained, that they can be a wonderful resource, but sometimes not. So that's what I would do, okay? Sorry about that. Okay, here we go. How long does it take to get the Medicare number after application to Social Security Administration? Okay, so if you applied for Medicare only, then you should have your Medicare card in around a month, about 30 days. Now, you usually can go online within about 2 to 3 weeks and find out where the application is, and sometimes even get the number online, but about 4 weeks before you actually get the card. Now, what we do, because we're brokers and we are very reputable, so we actually have access to this system that we can go into. We actually can find those numbers as well. We can do that for our clients. We don't do that just for the random public, but we do have a way to go in and find those numbers, and we usually can find them within about 2 weeks, okay? And so, now, listen, if you tied your Medicare application to your Social Security application, that's probably going to take longer. That could take as much as 6 weeks or maybe even 8 weeks, depending on where you're from, because some of the Social Security offices are way behind, they're understaffed, and we're seeing a longer delay when it comes to Social Security because of this. They'll oftentimes get all the Social Security applications set up first and then take care of the Medicare enrollment. But if you did Medicare A and B only, then that's usually 4 weeks. Social Security could be 6 to 8 weeks. Okay? All right, let's keep going. All right, signed up with Jaden 2 days ago. What a great experience. So glad I did. Learned a lot too. All right, well, thank you, Brian, for the encouragement. Really, Jaden's a great guy. Hard worker, been with us for a few years now, and really a guy of integrity. So I'm glad you had a good experience. Thank you very much. All right, retiring Social Security, Medicare, moving from South Carolina to Texas at the same time, same month. Which state should I enroll in Medicare Supplemental Plan G? Well, both of those states are going to have very similar rates, very close. So if you're moving to Texas and you do have an address there, then I would probably go ahead and just establish everything in Texas just to make it easy. Now, if you don't have an address, you can't do that. So if you have an address and you can actually receive mail there, then that's probably what I would do. Okay. Now, if you're going to delay the move for 3 or 6 months or something, then I would say just go ahead and do it in South Carolina. Take everything with you to Texas. But again, if you're going to move soon, you have an address there, I would set it all up in Texas. But no, the mail's going to go there. Okay. All right. Let's keep going. I haven't had insurance for 19 years. Take no meds. Healthy. I'm 64. Looking at supplemental G and drug plan. Will I have to jump through hoops because I've been out of the system for so long? No, not at all. No. Here's why in time 26, because when you come into Medicare and you take it at 65, they don't look back at your past at all. As long as you have 40 quarters paid into the Medicare tax system, which you probably do, probably have more than that, you're eligible for Medicare, and it can all be done online. So it doesn't matter about your past. The only people that matters about the past are those that come into Medicare after 65. So if I come in at 67, my past matters. Now, I don't care about what I had when I was 50, but I have to prove I've had credible insurance back to age 65. So that's when we start Medicare. After 65, it matters. But if I start up to 65, makes no difference whatsoever. You can be uninsured your whole life and get Medicare at 65 as long as you've had 40 quarters, 10 years worth of taxes. All right. All right. Should I have a doctor's appointment before applying for a supplemental plan? I have no prescriptions, family history of hypertension. No, not at all. Not at all. Okay, so here's the reason. If you're going to take your supplemental plan at 65 or retirement, the supplemental plan has no underwriting 6 months of your B date. So if you're going to start at 65 on your Medicare A and B, then you're in a window where there is no underwriting at all. So you don't have to have a doctor's appointment, no medical records. They're not going to ask you any health questions. Now, if you've already started Medicare B and your 6 months is beyond now of B date, then we have to go through medical underwriting, but I wouldn't run off to a doctor's appointment because all we do is simply ask you health questions. But again, if you're within 6 months of your B date, starting Medicare, don't worry about it because they can't ask you health questions. They're not going to check meds, nothing. They will approve whatever policy you want, whether it's a G plan or an N plan, you will get that, I promise you. No underwriting required. All right? All right, let's keep going. I'm retired, federal employee, Treasury Department, still have my health insurance from work. Good, yeehaw. Will I be better? I'll keep my insurance to work and not when I go on Medicare A and B. Okay, well, Ron, it just depends on how much of a premium you're paying for your yeehaw coverage, and I don't know that. My rule of thumb is this: if it's costing you about $250 a month or less to be on your yeehaw plan, now I'm talking about per person, $250 or less. Then what I would do is enroll in A and B, let Medicare pay first, and let your yeehaw plan pay second. And what yeehaw will do is they actually will give you a reimbursement of about $800 a year to offset your Part B premium. Why? Because now they're in the second payer position. So it just depends on what you're paying. We have a lot of federal employees that are paying too much for their FEHB benefits. So what they oftentimes will do is they will suspend their FEHB benefits and get a Medicare Advantage plan, or they'll terminate FEHB and just get a traditional Med-Sup plan. But that's the issue. Anyone that's watching, if you decide to take a supplemental plan, you're going to have to terminate your FEHB benefits, your GEHA, your Blue Cross, and that's going to be permanent. So be sure you're comfortable with that decision. And we've done that with plenty of folks because their premiums were not attractive. FEHB is not attractive as it used to be. Also know this. When you make a decision about your GEHA benefits, and if you have a wife or husband or children on the plan, that's also going to impact them. So be aware of all those details. You're just in a very unique situation. But if you have a good rate, I would take A and B, let GEHA be second. It includes drugs. It's great coverage. All right. Hey, Daniel, I'm going to have to sit down. Okay, hey, folks, I'm just going to sit down here real quickly. So let me move my camera. I'm sorry, but my back is killing me. All right, let's keep going. Sorry about that. Okay. All right, really sorry, but I am dying. Okay, I'm like you and prefer to do my health care with supplements, and I believe in alternative health and TCM. Which would you get? I also was on Lasso till last year, so I'm going to do the G or N, yes. Okay. So what is your question here? G or N? Okay, really, I think both are great options. Let me tell you, here's my view. I think both are great. I would look at your budget. Some people would like to get the most comprehensive plan available. That's a G. Why? Because you only have one gap you're responsible for, and that's the Medicare B deductible once a year. So if you say, I want the most comprehensive, I'd get G. But if you say, I don't have to have the most comprehensive, but I still want a supplemental plan, then get an N plan. It's still wonderful. The possibility of excess charges, remember N doesn't cover those, is pretty small. It could happen, it does happen, but it's not often. They say less than 5% of doctors charge excess, less than 5%. So if you're not concerned about excess, doctors certainly have to let you know if they charge it. It doesn't happen anyways. And then the other issue would be on the end, you have some minimal copays. You go to the doctor, primary care doctor, specialist, then you'd have a copay, $20. But it sounds like to me because you do alternative medicine, functional type medicine, you may be going to providers that don't take Medicare anyway, so you're probably going to have minimal copays. So at least we've got an in plan that's going to cover us if we had something major. All right, so the only thing you're not going to have covered are those excess charges, and they're not covered, but they're so rare. So I think it's fine. So I would look at the premium difference. I wrote an in plan today. I don't write a lot of new business. I help run our company. So, but I wrote one for an old friend of mine, and he went with an in plan. And I thought it was a great decision. I think the difference was about $40 a month between N and G in this state. And so that's what he went with. And I think it was a great decision. I really do. And he knows to be asking, do you take assignment? Do you take original Medicare and don't charge excess? And he'll check on that. He told me, hey, if they're going to do it, I'll find somebody else. And so I think an in plan is fine. But if money's not a big issue, $40 a month difference, then take a G plan. You don't have to worry about it. It's kind of the direction that I would lean. But both truly are fine. Okay, let's keep going, Linda. Oh, man. I'm claiming survivor benefits on my deceased spouse's record. Okay. I just turned 64 this February. I don't plan to switch to my record until 70. Do I still need to enroll in Medicare and when should I apply? Okay, all right, so here's the way it works, Bridget. You turn 64 in February, so let's back up the clock, January, December, November. So you're going to get your Medicare A and B card around the 15th to the 25th of October later this year, okay? Because anyone that's receiving Social Security benefits, whether that's survivor, spousal, or their own benefits, is automatically enrolled into Medicare A and B. And the card shows up about 100 days prior to your birth month. That's why I said you're going to get the card 15th to 25th of October, okay? And so what will happen then, as far as your Social Security, you're going to have to call the Social Security office, or call, that's the best, when it's time to switch from survivor to your own retirement benefits. You have to initiate that. It will not automatically happen. You'll be eligible, so what I would do is about 2 to 3 months before you turn 70, call them up and say, on my 70th month, my 70-year-old birth month, I would like to begin my own retirement benefits. And then they will switch those. But you cannot make that application online. You have to call your local office and set up an appointment. You got a few years before you do that, but it's about 60 to 90 days before you turn 70. Okay? You're automatically enrolled into Medicare. And it is true the $185 will come out of your survivor check when you hit 65 next February. All right, next, Daniel. I got a notice from Vienna on RX coverage saying I needed to complete a form to verify my RX coverage or pay a lifelong penalty on my premium. How does that work? Okay, here's why. So here's what I know about your series. You came into Medicare Part D plan after 65. This is called a special enrollment period. And so what happens is, I don't know how old you are, but let's say you're 67 and you just started your drug plan and you went with Humana. So when Humana submitted that plan for approval to the Medicare office, your age basically you were flagged, and they saw that you weren't starting your drug plan at 65, but rather later, maybe 67. And so that letter you got is called a late enrollment penalty letter, and they're letting you know that they're going to penalize you unless you prove that you've had credible coverage back to 65 through some type of an employer-provided plan. So that's why they're asking, because you're eligible at 65 and they don't know who you were covered with through a group plan. So you have to let them know. So you can either fill out the form and provide that credible coverage insurance information, or they gave you an 800 number you can call and you can do it verbally. You can actually verify it. Now, I have clients that do both. Okay, they'll mail the form in and they'll also call. Okay, you can do both if you want, but if you only do one, what I would do is I would call. In the old days, we just would mail the forms in, and sometimes they don't get them, they don't get processed, and we have further problems. So call them and let them know it's about a 5-minute phone call that you've had credible drug coverage, and they just care about back to 65. They'll ask the insurance company's name, did you have drug coverage, and who is the employer, and a few questions, 5 minutes, and then the penalty will be dropped. But if you don't respond to the letter, either by calling or by mailing it in, then that penalty will stick, and it's a lifetime penalty on Part D. So be sure to respond to the letter. That's your responsibility. It won't take long. You do it, all will be fine. Okay, let's keep going. All righty, I'm retired. I have a pension and Social Security. I have also Horizon Direct Access Blue Cross Blue Shield from my past employer. Do I need Medicare Part B? If not, how do I get rid of Part B? Okay, you definitely, if you're retired, you're going to have to enroll in A and B, because if you keep the Horizon Direct Access, they're only going to pay second, okay? Only second. Now, unless that's some kind of an FEHB plan, federal employee plan, if you're retired from the federal government, then what I just said is true. At that Horizon Direct Access, they will not pay first any longer. I promise you they will not. So you have to enroll in A and B, and they'll take the second payer position. Okay, so you have to have B. Now, if you are retired civil service, then that would be different. But your issue would be if you are retired civil service, then if you have A only, then this Horizon Direct Access would pay first, but you would be the second payer on anything outpatient services, any doctor services. So I would never want to be in that position. Take A and B, and if you keep Horizon Direct, then they're going to pay second. Okay, let's keep going. All righty, what are your thoughts on Cigna being bought out? Will this affect Cigna G plan in the future? Yeah, I don't think so. Healthcare Service Corporation bought them. They paid $3.3 billion for Cigna. I think they'll be stable. I'm not really concerned about that acquisition at all. A lot of insurance companies get bought out. And so I just don't think it's going to be an issue. I've talked to a lot of people internally with Cigna. They're frankly excited about the acquisition by HCSC. So I don't think it's going to be a big issue. If someone makes a big deal of it, it would be totally speculation. What I want is I want a stable rate, and I think you should still be stable, okay? And if I'm wrong, then as long as you're halfway healthy, you can always switch. But Cigna G would not concern me at all. In fact, today, I told you about this buddy I wrote. I put him on a Cigna N plan. Today, I wrote that plan, and not concerned at all, okay? Let's keep going. Why doesn't Medicare pay for a yearly physical? Well, because Medicare exists to pay for things that are medically necessary. And by the way, I think Medicare is wrong in this, but Marvin Musi doesn't set the rules. But the way Medicare works is they cover things that are medically necessary. And so they don't deem, annual labs and some of these different services to be covered because they say it's not medically necessary. Now, if you have your wellness exam, which they do cover once a year, and doc is concerned about something, then they just simply order some of the testing. It's diagnostic. It's going to be paid by Medicare. It's just no annual physical. So that's the way it goes for now. That could change in the future, but that's how it is as it stands. Okay, I turned 64. Hang on just a second. I get a drink. Okay, I turned 64 this past February. I was laid off from my job of 37 years. I have COBRA until the end of August. When should I enroll in Medicare Part A and B in a supplemental plan? Okay, so this past February, which means just a month ago, COBRA till the end of August. So, well, here's the thing. You're going to have to get something. If I see what you're saying, I think you're telling me that you're going to turn 65 next February, and that's the way you read it. Okay, so if your COBRA is going to end in August, you're going to need some kind of transition insurance for September, October, November, December, January. So you're going to need 5 months of transition insurance. Now, if you work with us, we can help get all that set up, but that's what you're going to need. Now, to your Medicare question, you're going to turn 65 in February next year, so back to the clock January, December, November. So anytime after November 1, you will be in your initial enrollment period. Now, if you're on Social Security, you'll be automatically enrolled. But if you're not on Social Security, then anytime after November the 1st, you will be ready to enroll into Medicare. Okay, so that's the way you do that. And then you enroll in your supplemental plan at the same time. And by the way, for everyone watching, if you want us to help you with that Medicare enrollment, we do it every day, all day long. Our agents enroll people in Medicare and B. I did it for my buddy today. It took me 5 minutes. But he wanted me to do it because he wanted to be done right. So you have a myssa.gov account, and we'll take care of it from there. We'll get you enrolled in Medicare A and B. There'll be no problems. It'll be seamless. And our agents know how to do that, be happy to do it. And we don't charge you for that. It's just a service that we provide for our clients. So give us a call. We can help you with all that. Okay, let's keep going. Okay, Omar. So first off, the 6-month window has nothing to do with drug plans, okay? The 6-month window has to do with Medicare supplemental plans. That's 6 months of your B date. So let me tell you what I would do, Omar. If you want to put it off to the last minute, here's the way you do that. let's just say that your birthday is in April. So we're in our IEP 3 months before, the month of, 3 months after. Got it? 3 months before April, the month of April, 3 months after. So the last month you can put this off to start a drug plan. In my example, my birth month's April. So I didn't take it the 3 months before. I didn't take my birth month. I can put off May, June, and then July. You actually can enroll into a Part D plan for an effective date of August 1. So that's the last time you can do it. Latest you can do it with no penalty, July to August. Now, by the way, I'm not telling you to do that, because what happens if you need medications in May, June, or July? You're going to be out of pocket on those. Okay, but if you want to put it off, you can legally, without penalties, without problems, other than you have no coverage, until July, in my example. So that third month would be the last month that you could enroll. So 3 months before, a month of, 3 months after. So it's that 3 months after, that third month would be your last month. All right, let's keep going. Okay, very good. All right. Well, Bridget, here in Kansas City, our office is in Corporate Woods. We have 80 employees right here every day that are happy to help you. So if you want, you can call in the 800 number, or you can actually come into our office. Happy to have you do that. We're in Corporate Woods, Building 24. And so you can call the number and set up an appointment. We're happy to do business by phone. That's how we do most business around the country, is by phone. But because you're in Kansas City, you can come in if you'd like. All right, is original Medicare A and Part B only? Yes, it is. That would be correct. So when someone has only A and B, they have inpatient and outpatient, but all the financial gaps are their responsibility. So when I refer to original or traditional Medicare, that's exactly what I mean. A and B only. Okay. All righty. Here we go. If I enroll in Medicare and supplemental plan and don't start collecting SSA yet because I get a job, what happens? Okay. Number one, if you decide to do this, and let's say you do get a job, because I think what you're asking me is if you go ahead and start Medicare and you get a supplemental plan, and then get a job that offers you benefits, if that employer insurance is better than your Medicare option, meaning premiums better, coverage is better, then you can always drop your supplemental plan, your drug plan, and your Part B. You cannot drop A once it's started, okay, unless you buy A. If you buy A, you can drop it. But if A is premium free, which is 99% chance it is, then you can't drop A. But it's free anyways for most people, zero premium. So yes, if your your group plan's better, you can always drop it. I have a lot of people in this situation. So if you're approaching 65 and you don't have a job yet where you have group coverage, go ahead and get enrolled into everything, get it all set up. And if you get a job in 2 months or 6 months or whatever, and that job offers you better coverage at a better price, then you can drop B, you can drop the supplemental plan and the drug plan, all of those. No problem at all, and then you can pick them up later when you retire. All right, next. Are we supposed to choose a plan before the Medicare start date? I sure would, Pamela, if it were me, because you can make all the decisions before the start date. In most states, 6 months in advance, some states 3 months in advance. So if you're within that 3 to 6 month window before your B starts, you can start looking at all the plans. Yep. And we take care, of course, all that for you in the enrollment as well. All right? So before is always best. Because really what I like, folks, I want to start my A and B, and I want all my other insurance to go into effect at the same time. It's very seamless. All right, retire and still have my horizon. I received SSA and pension incomes. I have Medicare A, B, D, and G, as well as the Aetna Cancer Plan. Do I need or must I keep Part B? Okay. You're saying, okay, well, here's the thing. I have to know, are you a federal employee? Daniel, because I can't answer that unless I know I'm dealing with a federal employee. Okay, and then if you go back in there, sweet tea, let me know about that. When you say you're retired from where? And then I'll answer your question. Okay, let's keep going. Okay, will Medicare pick up what my employer coverage does not? Not necessarily. Now, here's the way it works. If you are in a group of 20 or more employees, meaning employer 20 employees on the payroll or more. That means Medicare is in the second payer position. So your group plan is going to pay first. So Medicare in the second payer position for like a hospitalization will not pay any deductibles that you're responsible for. They will not pay for any copays for hospitalization, but they will pay for co-insurance in the second payer position. Okay? So I think that's what you're saying. So never assume that Medicare is going to pick up everything your employer does not. That's not going to happen. Now, will those benefits be coordinated and will they cover something? Probably so. But you're saying everything they don't cover. That absolutely would be no. Sometimes it could be a yes, depending upon the claim and the coinsurance amount, all that, but not necessarily. Okay, there's just more to it than that.
This one's kind of a long one, but it's like 3 separate messages.
Okay, here we go. Okay, David, I turned 65 in February, and I'm in the open enrollment period in March, April, May, true. I went on COBRA in February. I just started a new job last week and will be eligible for a large company's plan. I would like to use the company's plan for the HSA insurance, plus my wife would be protected if she needs coverage. Okay, let's go back. Is there no way you can, okay, just let me see the first one more time. I turned 65 in February, I'm in the open enrollment period. I went on COBRA. Okay, so David, number one, I'm assuming that you're not on Social Security. I'm assuming that. So I started a new job last week, will be eligible for a large company plan. Okay, let's keep going now. I would like to use the company's plan for the HSA insurance plan. So don't enroll into Social Security and don't enroll into A for sure. Plus my wife would be protected if she needs coverage. Keep going. I believe I may have a gap in my insurance, but I am not sure if it will cause me a problem. I think I have 12 months before I have a penalty. I'm not sure if both medical. Okay, this is a big deal, David. Okay, so now go back to his first question. I want to make sure I know when he turns 65. Okay, here's what you need to do. Is this. It is true that you're still in your open enrollment period. If you're on COBRA right now, you need, David, to enroll into Medicare right now. In fact, I hate to scare you, but you have already created a problem for yourself. Okay? So I tell you what I want you to do, David. Daniel, this is how could we reach out to him, talk to him? Yeah, David, boy, oh boy. Okay, you need to enroll into Medicare this month, okay? And they're going to backdate your A date to 2/1 of 2025, and you're going to have a B date effective 4/1/2025, okay? So your problem is this. If you get off Medicare and you take your large employer-provided plan and you stay on that and then you retire and then want to come back into Medicare, COBRA is not considered credible coverage, so you do not qualify for an SEP. You just don't. So you have already made a mistake, David. I'd be happy to talk with you about this. What I would do is I would go ahead and go on Medicare now because your COBRA is only paying second. Right now, David, you're the first payer. You're in a pitiful position. And so you need to get on Medicare now, A and B. So A is going to be, again, 2/1, B is going to be 4/1. And then you need to stay on Medicare forever from now on. I don't care how good that group plan is going to be. What I would do is I'd go to the employer and say, hey, I'm going to stay on Medicare. And what they may do, they may give you a pay raise because now they don't have to cover your insurance. But I promise you, you're in a pickle. What you should have done, if you would have went ahead and enrolled into Medicare effective 2/1, 2025 A and B, then you wouldn't be in this problem because then you've had credible coverage or an employer plan back to 65. But you don't have credible coverage back to 65 now because you've gone February and March with only COBRA, and that's not considered credible. That's your problem. And I'm sorry about that. That is just, you're not in a good position. But you need to go on Medicare now, stay on it forever, or you're going to have a problem down the road.
He said he can call, so I just want to...
Okay, Debbie, yeah, call in and do me a favor. Listen, I want you to ask for Christina, and Christina, ask for her. She'll be working tomorrow. She's probably off right now, but just ask for Christine and tell her that Marvin said for you to call as a result of our live program, and she'll get your phone number from you, and then I will call you personally. Just make sure you tell Christina I said I would call, and I will. Now, I'm off tomorrow, so I'm not going to call you tomorrow, but I will call you on Monday. And, well, that's kind of bad because that's the 31st. I'll tell you what, you call in tomorrow and tell Christina to text me tomorrow, and I will call you tomorrow, okay, on Friday. And tell her to text me, and I'll reach out to you, and we can talk about this further to clarify everything I just told you, because I probably scared you, but I'm dead serious. You're not in a good position, sir. Okay, let's keep going, and please call in. I will. I'll call you tomorrow. All right, turning 65 in June this year. Can I enroll in Part A in June? Hold Part B for 3 months and hold Sup G for 6 months without any problems. Okay, no. Now, you can hold it, but you're going to have problems. Okay, so you turn 65, can enroll in Part A in June. You can do that for sure, and you have A only. So hold Part B for 3. So if your birthday's in June, so July, August, September. So in September, you could apply for Part B and have an effective date of October 1. But the problem is, if you don't have a group plan you're covered by, you're in a very risky position. So if you're wanting to take that risk, you can do that. I wouldn't personally do that, but you could. Okay, so birthday's in June, enroll in June, your A date's still going to be, 6/1. So if you put it off July, August, September, you enroll in September for an October 1 start date, you would start your B date then. And then from that point on, now if you want to, from the B date, you have up to 6 months to enroll in a supplemental plan, no underwriting. So that month of October counts though. October, November, December, January, February, March. So you can enroll as late as March for an April 1 start date of Part B. With your Part G or N supplemental plan, and you can get by with that. And again, it's not like that's a bad plan. I'm just saying, to me, that's a risky plan because you're going without insurance longer than I would want to go without. But you could do it, yes. I'm not recommending it, but you could. All right, Hector, go ahead. Okay, if you get an implant, a regular doctor or specialist, the same $20 copay, yes. All professional providers, that would be a mental health provider, primary care doctor or specialist, can charge you up to a $20 copay. Now, it could be $18, could be $16. It can just be no more than $20 copay. So the first thing you do is you meet your B deductible. That this year's $257. So that could cover a couple doctor visits. And then after that B deductible is met, then it's 80-20. The Medicare pays 80. Your plan pays the 20% less that $20 copay. That's the way it works. Okay, here we go. I'm applying for Medicare now, 65, no prescriptions. All need is a CGM to prevent, prevent starting metformin, et cetera. What plan for preventive? Okay, I appreciate your abbreviation, but I'm not getting your question here. All I need, prevent starting metformin. What plan pays for preventive? Okay, well, yeah, it sounds like to me that you're not going to plan to get a supplemental plan or like an Advantage plan. So what plan pays for preventive? Original Medicare will pay for preventive. But that preventive list is pretty limited, just so you know. You actually go on to Medicare.gov, or you can Google Medicare preventive services, and you'll see what's going to be covered. Okay? So I wouldn't do that. I would get a prescription drug plan. There's some out there that are very low cost. I know you don't need expensive meds now, but that could change. So a very risky position to do that. But you could. All right, can I switch from one Advantage plan to another without going through a health exam for it? Yes. Yeah, 2 times a year. If you can get an Advantage plan at 65, you can switch those 2 times a year. The first quarter of every year is called the OEP, January 1 to March 31. One time during that 3 months, you can switch plans. And then you can switch plans October 15th to December 7th. That would also start January 1. So 2 times a year, you can switch, no underwriting. That's true. All right, are you allowed a full physical at initial enrollment? No, there's never really a full physical at initial enrollment at all. The first 12 months, there is a broader, it's called Welcome to Medicare physical, but it's not a full physical. It just is not. It's just a little bit more in depth than the annual wellness exam. But they're going to check, your height, your weight, body mass. They will. I think you get it. I think you get an eye exam during that first one. There's a couple extra items the first year, but after that, they're just an annual wellness checkup. So, and they're concerned about health history, making sure that your records are right, knowing what meds you're on, and all those kind of things. So it's more really just a kind of a verbal type of examination. It really is a collecting of medical records and all that, making sure they know what your situation is, and then they'll take it from there. But it's definitely not full physical at all. Okay, let's keep going. Okay, I have type 2 diabetes, get blood work, and doctor visits every 6 months. Will Part B cover that? All right, so if it's medically necessary for you to have those items, then the answer is yes. Medically necessary, Part B will cover that. Now, you still have a Part B deductible once a year of $257, and you're going to have to pay 20% coinsurance. So that blood work and doctor visit is not going to be considered preventive, but it will be considered covered. All right, so it will be, but you're still responsible for the B deductible and for the 20% coinsurance. But if you get a supplemental plan, a G or an N, they're going to cover that 20% coinsurance. Retired 724. I'm receiving a severance and health benefits that will end 3/30 or 1/25. Is the company obligated to provide me an option to continue with their dental and vision at a cost? They are obligated to offer you COBRA for dental and vision for 18 months after you retire. So yes, and we have plenty of people that COBRA their dental and vision. And if it's probably a good price, then I definitely would do that. So yes, they have to. That's just law. Okay, so you can do that. But if they charge a premium, that's you have to pay it. They don't have to offer it to you at free. Just because it's free now doesn't mean it has to be free then. They actually can charge whatever the normal rate would be for someone that would be on COBRA. So that's not going to be zero. So I've never seen it. All right, I have Medicare Advantage in Florida right now. Do I need to have medical underwriting if I relocate to New York and switch to a Plan G? No, you don't. So if you move to New York is a continuous open enrollment state, so there is no underwriting required for supplemental plans in the state of New York. Now, if you started Medicare before January 1, 2020, then you may be required to get an F plan. If you started Medicare after 1/1/2020, then you should be able to get a G or an N plan in the state of New York. No underwriting at all. So you can move. In fact, really, anyone watching this, if you have a Medicare Advantage plan and you relocate to any state, you're eligible for a guaranteed issue supplemental plan. So if you move out, whether it's New York or wherever, but New York specifically, they never have any underwriting. They're open enrollment, no underwriting continuously. All right, let's keep going. Is physical therapy subject to copay in Plan N? My understanding is yes, because you're under the care of a physical therapist. And so every time you go in for therapy, let's say knee replacement, you have therapy, then I think you're subject to up to a $20 copay. So I believe that's the way it works. Because the physical therapist is also, licensed and professional, so that would be considered a copay for the doctor. Yep. Okay. Well, 2KOP. I hear companies are excluding expensive drugs from their drug plans. Is that true? Okay. Well, it is true. There are some plans that are not going to be as broad of a formulary as others. So that's why I said earlier, when I pick a drug plan, I don't care about the premium. I care about the formulary. Are my medications covered? Because any medication that is covered, that $2,000 is going to apply. That's why you just simply don't enroll into a cheap drug plan because of premium. You want to make sure meds are covered and then make your decision. Okay? All right, let's keep going. I signed up for supplemental plan with your company, but my drug plan seems high for a tier 1, starts July. Can I have this rechecked? Yes, Sandra, do that. If you're a client of ours, call in and ask for a tier 2 agent, so someone in customer service agent, and they can rerun that for you. And let us know what you want. Happy to do that. please. It's not a problem. I'm not sure, what drug plan you're on or whatever, but yeah, let us recheck that for you, especially since you got a couple months out before you start. Happy to do that, Sandra. All right, I'll be 65 in July. I can reject Medicare at this time and stay on my husband's insurance. My question is, would I be better off with Medicare and supplemental plans far back as for back injections? My deductible is so high now, but my head, okay, well, okay, number one, Gene, as long as your husband's plan has 20 employees or more on the payroll, then you don't have to do Medicare A or B. But if you have a high deductible and you're going through these back injections, what I'd want to do is, what's it going to cost you to do that? And again, I don't know how much income you all make, but if you don't have an IRMA because of high income, you can be on Medicare. Let's give an example. Today, I put this buddy of mine on Medicare, $187 a month for his B. His supplemental plan was an in plan, $143. So $143 and $187 gave him a premium of $330. Put him on a zero. Will put him on a zero drug plan. So he's on a plan with a $257 deductible for the whole year, and it cost him everything $330 a month. So that's what you've got to look at. What's it cost you, your husband? I know you say it's cheaper, but how much cheaper? And what's the deductible, the max out of pocket? So take the time to compare that $300 or so a month versus the coverage with your husband as far as your total out-of-pocket expenses. So do a little bit of homework and then make your decision. And if you want us to help you with that, call in. We'll happy to make that comparison.
Okay, it's 6:31.
Okay, all done? Okay, folks, well, we are done. We've hit our hour-and-a-half limit. If you need further help, please call the number on the screen, and you'll be transferred to an agent or talk to an agent that I actually trained. All the agents in our company, I oversee, I train them, so they're well-versed in Medicare. We'd be delighted to be your broker. Remember, and I'll close with this, we never charge our clients anything. We are totally free to use. So if you use us as your Medicare broker, there's no cost at all to use our services. The insurance companies set the premiums. We don't, they do. So the premium is always the same no matter who you use, but the quality of service and type of service you get really varies. So we'd love to be your broker. Give us that opportunity. We take great care of you. Thanks a lot for watching. We'll see you